Hey there, lovely viewers. Welcome back to our channel. Today, I want to share a story with you that starts off with pure joy but takes an unexpected turn. It's about Mia and how her journey towards motherhood took an unexpected detour. So, grab your favorite snack, sit back, and let's dive into this fascinating tale. I highly recommend staying until the end of the video. It has been carefully crafted with considerable effort, and I believe it will deliver valuable and informative content for you and your loved ones. Once upon a time, there was a young woman named Mia. She had just found out that she was pregnant, and she felt sheer happiness in her heart. Mia had always dreamt of becoming a mother, and now, her dream was coming true. She couldn't wait to embark on the beautiful journey of motherhood. But one day, Mia went for her routine blood tests to ensure the health of her baby. Little did she know that those test results would change everything. Doctor said, "Mia, your HCG levels are exceptionally high, which is not common. We need to investigate this further." Mia's doctor recommended an ultrasound to determine the cause of the elevated HCG levels. As she lay on the exam bed, a sense of unease washed over her. She was about to find out something that would shatter her happiness. "Mia, the ultrasound shows that you have a condition called molar pregnancy. It occurs when there's an abnormal growth of tissue inside the uterus instead of a fetus." Mia was taken aback by this unexpected diagnosis. In her mind, so many questions raced around. How did this happen? What does it mean for her and her dreams of becoming a mother? "Mia, molar pregnancies are rare, and the exact cause is still unknown. It occurs when there's an abnormal fertilization of the egg, leading to the growth of abnormal tissue. Unfortunately, Mia, in this case, a baby cannot develop." Devastated by the news, Mia leaned on her loved ones for support and sought comfort from others who had experienced similar situations. They helped her understand the complexities of molar pregnancies. But Mia didn't stop there. She took it upon herself to dig deeper, researching molar pregnancies to better comprehend the condition she was facing. A molar pregnancy results from problems that occur when sperm fertilize an egg. In a typical pregnancy, a placenta forms to nourish the growing embryo. A placenta doesn't form normally in molar pregnancies. Most people receive treatment and go on to have healthy future pregnancies. A molar pregnancy showing a uterus filled with small, fluid-filled sacs, tumors instead of a placenta. In a molar pregnancy, non-cancerous cysts form instead of a healthy placenta. Without a healthy placenta, the embryo doesn't survive the pregnancy. What is a molar pregnancy? A molar pregnancy occurs when an egg and sperm join incorrectly at fertilization and create a non-cancerous tumor. The tumor looks like tiny water-filled sacs, similar to a cluster of grapes. The tumor can't support a developing embryo and the pregnancy ends. Some people have a miscarriage. If this doesn't happen, surgery is needed to remove the pregnancy. If left untreated, molar pregnancies can cause serious complications. Molar pregnancies are a type of gestational trophoblastic disease. Gestational trophoblastic disease is a group of conditions that cause tumors to grow in your uterus. Molar pregnancies are also called hydatidiform moles. What are the types of molar pregnancies? Molar pregnancies fall into two categories, complete and partial. In complete molar pregnancies, no embryo forms. It happens when a sperm fertilizes an empty egg. Because the egg is empty, the embryo can't grow. The placental tissue grows but is abnormal and contains fluid-filled cysts or tumors. This tissue produces the pregnancy hormone HCG, also called human chorionic gonadotropin, which is made by a healthy placenta during pregnancy. This can make you feel like you're pregnant and give you a positive pregnancy test. On the other hand, a partial molar pregnancy occurs when an abnormal placenta forms along with an embryo, and two sperm fertilize one egg. In these cases, the growing embryo has an extra set of chromosomes. The embryo may start to develop but generally can't survive. Who is likely to have a molar pregnancy? Although molar pregnancies are rare, anyone can have a molar pregnancy. You're more likely to have a molar pregnancy if you are younger than age 20. Or you are over 40. Have a history of molar pregnancies. Have had 2 or more miscarriages. Are of Asian descent. How common are molar pregnancies? Less than 1% of all pregnancies, about 1 in 1,000, are molar pregnancies. Can a molar pregnancy lead to a normal pregnancy? Unfortunately, a molar pregnancy results in the loss of the pregnancy. What are the symptoms of a molar pregnancy? Some people don't have any symptoms of a molar pregnancy. For those who do, the most common include vaginal bleeding within the first 3 months of pregnancy, severe nausea and vomiting, grape-like cysts coming out of your vagina, preeclampsia, extremely high blood pressure, abnormally high HCG levels, abdominal swelling and anemia. These symptoms are similar to many other conditions. It's best to report any unusual symptoms to your healthcare provider. What causes a molar pregnancy? Molar pregnancies are caused by genetic errors that occur during the fertilization of an egg by a sperm. In a typical pregnancy, an embryo gets 1 set of chromosomes, 23, from each parent for a total of 46 chromosomes. Chromosomes are structures that contain genes. Genes tell your body how to work. Molar pregnancies contain an imbalance of chromosomes. In a complete molar pregnancy, the egg contains no chromosomes. The embryo gets 23 chromosomes from the sperm. In a partial molar pregnancy, an egg is fertilized by 2 sperm. This results in the embryo having 69 chromosomes. This genetic error leads to an unsuccessful pregnancy. How is a molar pregnancy diagnosed? Your healthcare provider diagnoses a molar pregnancy during routine prenatal tests, usually in the first trimester. An ultrasound of your uterus often shows several fluid-filled sacs instead of a placenta. There's usually no embryo or fetus in your uterus, but sometimes pregnancy tissue remains. Your provider can also measure HCG levels in your blood. A healthy placenta produces HCG during pregnancy. It's the hormone that at-home pregnancy tests measure in your urine to confirm a pregnancy. In molar pregnancies, HCG is produced at abnormally high levels. A blood test can detect these high levels and suggest a molar pregnancy has occurred. Some people won't have any symptoms of a molar pregnancy, and the diagnosis can be quite shocking. Just know that you did nothing to cause a molar pregnancy. In most cases, you can subsequently become pregnant with a healthy pregnancy if you chose to. A molar pregnancy must be removed from your body or it can cause serious complications. People generally require surgical treatment to remove molar pregnancies. Treatment involves dilation and curettage, DNC, with suction to remove all abnormal tissue from your uterus. General anesthesia is given so you don't feel pain during this surgery. In some cases, medication to help your uterus contract and expel the contents of your uterus is used instead of surgery. Talk to your healthcare provider about the best treatment option for you, as urgent treatment is recommended for molar pregnancies to help prevent complications. In very rare cases, a hysterectomy, or surgical removal of your uterus, is necessary to treat a molar pregnancy. Your healthcare provider will monitor your HCG levels until levels return to normal. This ensures all the molar tissue is gone. HCG levels that don't return to normal may indicate more serious complications. What complications are associated with molar pregnancy? Occasionally, parts of the molar pregnancy remain in your uterus after surgical treatment or miscarriage. If this happens, abnormal cells may grow into the muscle layer around your uterus, also called an invasive mole. This is rare and happens in less than 15% of people who've had a molar pregnancy removed. In very rare cases, molar pregnancy causes a type of cancer called choriocarcinoma. Choriocarcinoma forms within your uterus and may spread to other parts of your body and requires cancer treatments such as chemotherapy or radiation. Other potential complications of a molar pregnancy include infection of the blood, sepsis, uterine infection, preeclampsia, very high blood pressure, shock, very low blood pressure. Can molar pregnancy be prevented? There's no way to prevent a molar pregnancy. If you've had a molar pregnancy, you can reduce your likelihood of complications by avoiding another pregnancy for up to 1 year after your initial molar pregnancy. Talk to your pregnancy care provider about when it's safe to begin trying to conceive. What is the prognosis outlook for people with a molar pregnancy? Most people who receive treatment for a molar pregnancy have no further complications. If you have a molar pregnancy, your risk for miscarriage doesn't increase. You're only at a slightly higher risk of a second molar pregnancy. Some people find it helpful to seek genetic counseling before conceiving again. There aren't any indications that a molar pregnancy should affect your decision to try to conceive again if you wish to do so. Does a molar pregnancy cause infertility? No, it doesn't cause infertility. However, you should avoid becoming pregnant for up to 3 months. This allows your HCG levels to return to pre-pregnancy levels. Ask your pregnancy care provider about when you can begin trying for another pregnancy. Is a molar pregnancy a type of miscarriage? A molar pregnancy usually results in the loss of the pregnancy. It's normal to be disappointed and sad that you aren't pregnant. Take time to grieve the loss. Look for support from your family, friends, or support groups that deal with losing a pregnancy. If you've had a molar pregnancy in the past, you're likely to have a healthy pregnancy in the future. When should I see my healthcare provider? If you're pregnant and experiencing vaginal bleeding, severe nausea and vomiting, or passing grape-like cysts from your vagina, contact your pregnancy care provider immediately. Prompt evaluation and treatment are necessary to prevent complications. A molar pregnancy can be a traumatic and upsetting experience. Molar pregnancies result from genetic problems that occurred during conception that are out of your control. Treatment for a molar pregnancy involves either a dilation and curettage procedure or medication to remove the abnormal tissue. Afterward, we will carefully monitor your HCG levels to ensure a full recovery. Mia underwent the recommended treatment, putting her faith in the doctors and the healing process. It was a challenging and emotional journey, but she persevered. And slowly, day by day, Mia began to heal both physically and emotionally. Supported by her loved ones and supporting husband the strength she found within herself, Mia discovered a newfound resilience. And then, when she least expected it, life surprised her once again. Mia discovered that she was pregnant, and this time, it was a healthy pregnancy with a growing baby. Mia's journey towards motherhood took a detour, but it didn't define her. It taught her resilience, love, and gratitude. Today, Mia is overjoyed, preparing for the arrival of her little miracle, cherishing every moment of this incredible experience. What an incredible story, filled with ups and downs, but ultimately ending in triumph. Mia's journey reminds us of the indomitable human spirit and the power of hope. If you've experienced something similar, remember, you're not alone. Reach out, seek support, and always hold on to hope. Thank you for joining me on this emotional journey. Remember to like, share, and subscribe to our channel for more inspiring stories like Mia's. Until next time, keep believing in miracles.